the telltale signs. I know, doctor, you already touched on one by saying that that fever is the abnormal fever, not the regular fever that we all have. If it's completely different from what we normally have, then maybe that could be one of the early signs. What are some of the other telltale signs and the symptoms of dengue infection that we all should be vigilant about when monitoring our health at home, especially? Yeah.
Okay. Okay. Other than high fever, usually if it's a common cold, common fever, whenever we take paracetamol, the fever will subside.
Mm-hmm.
Whereas for dengue, even with paracetamol, the fever will be persistently high.
Mm.
And you will have a very severe headache. There will be pain behind your eyes, severe joint pain, muscle pain. If you want to move yourself, also, you find it very difficult even from your bed. If you want to go to the washroom, you find that it's a very big task for you to do.
Mm.
It's that painful and tiredness, very
Fatigue.
tired, very fatigued,
Mm.
and of course you may be down with vomiting, diarrhea, as well as there can be some minor bleeding. There will be a nose bleed, there will be a gum bleed, there might be blood in your urine. So all these are the warning sign of things that you have to be aware of.
So, doctor, you distinguished between the early phases of dengue, and you spoke to, and then you alluded to some of the other repercussions that it can lead to. But give us a worst case scenario. What is the most severe physical condition that can arise from dengue infection that is left unattended, that is left untreated, doctor?
What I told just now is all the dengue symptoms, but some of our patients, they may not go into this. Okay, let's talk about the phases of dengue.
Okay.
The first phase is a febrile phase, second phase is critical phase, and the third phase is recovery phase. So during the febrile phase, whatever symptoms like fever, headache, pain behind the eye, pointing will be there. But we are only worried when a patient goes into the critical phase. This is where the blood vessel will become leaky.
Right.
The fluid from your blood vessel will leak out. So where it leaks out will be your lungs, your abdomen. So when this happens, that's why you see the patient will present with difficulty in breathing. They'll come with abdomen pain. Even I've seen patients where even the heart is involved, the brain is involved, they can get fatigue, they can get bleeding in the brain. And let's say it affects the heart, your heart rate will be low, So
Right.
these are the severe form of dengue.
Okay. Thank you very much for sharing us those insights in this first part of Health on TRAXX, Dr. Siva. We'll jump in for a quick break, and then when we come back, we shall resume with the discussion. All right, I'm today now speaking to Dr. Siva Perumal, a consultant emergency physician at Prince Scott Medical Center. And today on Health on TRAXX, we're speaking on the rise in dengue cases. We'll jump in for a quick break. When we come back, our discussion right here continues. We are speaking to Dr. Siva Perumal, a consultant emergency physician at the Prince Court Hospital Medical Center, and we're speaking about the rise in dengue cases. Dr. Siva, welcome back to Health on Tracks.
Yeah, no.
All right, Dr. Siva, now, with the rise in dengue cases, what do you think are some of the key steps we can take to protect ourselves and prevent the spread of the virus in our homes and in our communities, Doctor?
We have to eliminate all the breeding area of the mosquitoes. So this is something I think I've been watching since I'm a kid. It's always in the radio, in the newspapers. Take some time weekly to clean your surrounding area. Any place where there is potential, where clean water will be stagnant. So we have to clean all those things. But most of the time, we always forget that we're also breeding mosquito inside our house. The olden days, the toilet flies, the place that we keep, after washing our plates, the container that we keep to dry our plates.
Right, yeah.
I know I'm on air.
The
even
drainer.
that happens. Even that happens in my house. So I make sure, I check regularly.
Yes, we overlook that. We leave our plates thinking the water will drain, and then we forget to just drain that water out and just let it be stagnant there.
Then even my mom, she likes to keep plants at the house, and it's put under the water.
Right.
So we always forget to check all these areas. So it's only not breeding outside the house, but also inside the house as well. And I think nowadays in most of the community, most of these residential areas, they've got this WhatsApp group and so on. So it's always good to update in that group. In that group that see the dengue outbreak in our residential area. The other thing that I will always ask my patient is there any recent fogging of place? So it's good for the community, to be aware of what's happening around the area. Is there any recent fogging? The question, the answer that I will always get, I'm not at home, from morning till night.
Yeah.
So if let's say there's an outbreak or there are cases in that particular area, they will put a banner, about how to prevent and all those things. So let's say there is an outbreak, as a community, of course, in Malaysia, they are good in gotong royong.
Yeah.
So I think some gotong royong should be taking place. Yeah. So of course, let's say, as I said, if let's say the individual, if your fever is a bit different from your norm, seek healthcare facility, check your blood. Check your blood whether you've got dengue or not. It's not that all dengue needs to be admitted. So let's say it's just a simple dengue, your blood parameters are normal. Just stay at home, stay hydrated, rest, and don't, I know, dengue is very painful. You'll have severe body pain. Don't take any painkillers, because painkillers can worsen your condition.
So don't take painkillers. That's a definite no-no. Off limits.
Yes, only paracetamol. Only paracetamol. Yeah. And also, don't overdose yourself. It's only 2 tablets every 6 hours. Don't take 2 tablets every 2 hours. Okay?
Yeah.
So, managing your fever, you have to take bath often. Don't use hot water.
Don't use hot water.
Yeah. Because it's what happens, let's say you see the temperatures of the water is more than 37 degrees. What is going to happen is, instead of taking away the heat from your body, it's going to make your body more heated up.
Right.
So the temperature of the water should be lesser than your body temperature.
So you're able to regulate our body temperature as well, so it shouldn't be spiked up. Right.
Yeah. And also the most important thing is the mosquito protection, mosquito repellent. And Aedes is a day biter. So if you see mosquitoes in your house at night, don't get worried. That's not Aedes.
So Aedes is a day biter, doctor.
Day biter.
All right.
Yeah. So it usually bites you say about 6:30, 7 in the morning.
Ah,
So
so
that's the reason
this
why.
guy is not nocturnal. So this guy is
Yeah,
active during the day.
yes, yes. Okay, that that is why you see fogging is done during that hours.
Right. Now that makes
Mm.
sense.
That,
Okay. Okay.
yeah, yeah, yeah. Mm.
Hmm.
So these are the some measures that we can take to protect ourselves, our family, as well as community. So
Okay.
always stay informed.
Hmm.
This dengue has been there for a very long time,
Yeah.
and dengue is something is preventable,
Hmm.
and dengue death is also preventable.
Okay. And who do you think, doctor, is more susceptible towards dengue virus? The kids or adults or elderly people? Who is more susceptible?
From my experience,
Hmm.
as well as studies, kids are always they they do well. They do well.
Hmm.
Probably because you see they are young. You see the organs are still new,
Hmm.
and they've got the enough reserve. So kids will do well.
Hmm.
Usually, you see the vulnerable group are the ones who are immunocompromised,
I
the one who's
see.
got diabetic hypertension, you know,
Hmm.
all those chronic illness. So these are the groups that we have to take care of them. And even in our Malaysian guidelines, those who have got all these chronic disease, like say diabetes, heart
Hmm.
problem, kidney problem, lung problem.
Hmm.
So even though they have got simple dengue, it
Hmm.
is recommended to admit them. So
Okay.
it's easy to monitor them because dengue is something. If you look into our Malaysian guidelines, it
Hmm.
says dengue is systemic as well as progressive disease. I mean,
Systemic and
uh,
progressive. Hmm.
yeah. So which means you see, it attacks all the systems. It attacks your brain, your liver, your lungs, your kidney, your heart, everywhere.
Hmm.
And you can see someone who's okay at 5 o'clock in the afternoon,
Hmm.
they can change condition within 7 o'clock.
Whoa.
Yeah.
So you
So
mean 7 p.m., 5 in the afternoon, just a span of
yes,
2 hours? Wow.
yes, yeah, yeah.
Hmm.
So it's good to monitor all these people with chronic illness, the elderly in health center. At least if they deteriorate, management can be done fast. Medical management can be done fast.
Okay. Okay. Thank you, doctor. Oh wow. This is a revolution for me. Today that I discovered that the Aedes mosquito is a day biter. That this guy is not active during the night. But doctor, let's jump in for another quick break. When we come back, maybe we can dive deep into some of the misconceptions, and you can break the stereotypes, that false fallacies that people have been having opinions on Aedes, and also on dengue as well. When we come back after a break, yeah, doctor.
Yeah, sure, sure, right.
All right, today I'm speaking to Dr. Siva Perumal. He's a consultant emergency physician at Prince Court Medical Center, and he's talking to us today on the rise in dengue cases and how we can battle it and prevent ourselves from being infected with the virus. We'll jump in for a quick break, and when we come back, Health on Tracks will resume right here on TRAXXfm. Is Dr. Siva Perumal, a consultant emergency physician at Prince Court Medical Center. And Dr. Siva today is speaking to us about the rise in dengue cases. Dr. Siva, welcome back to Health on Tracks.
Hi.
All right, Doctor, so this was the hook that I gave before we went into the break. I want you to debunk and clarify any misconceptions or any fallacies that you think that's out there that you oftentimes come across, and you have to re-educate your patients. So, you've got to iron things out for them and debunk their misconception about dengue.
Okay. One of the remedies that our society like to take is papaya leaf.
Yeah.
I've seen through some studies, small studies. It's not really convincing. It's not really convincing saying that papaya leaves can cure dengue. And you being Indian, I'm being Indian. I'm not sure whether you've heard that.
Rasam.
Nandu rasam.
Crap rasam.
Yeah, the crab rasam, it can cure.
Yeah, and they specifically ask you to use the snapper. Make sure you make the rasam with the snapper.
Yeah.
Not with the main shell. Yeah.
Yeah, but of course, you see, when you are having high fever, you see your appetite is poor. With this spicy fat soup and all those things, this but of course it will increase your appetite. But there's no study saying that this nandu rasam, can cure dengue. It's usually, and also, some they claim to take some herbs from some other overseas country, which is very bitter and fight dengue virus and so on. Dengue is a virus. And once the virus gets into our body, and our body has to produce the antibodies to fight against these viruses. So typically it will take about 5 days. So some of them probably, they will have to take whatever supplements probably on day 7 or day 6, where you are almost in the area of recovery.
Right.
So by taking all these crab soup or this papaya leaf, whether you take it or you don't take it, you're already in the verge of recovery. Yeah. So probably, this myth, they think, I've taken 1 bottle of papaya juice and done fantastic work and I've recovered from dengue. So these are some of the myths still there in our society. And I think if you walk into any supermarket, you can see this papaya leaf juice sold commercially.
Yeah.
But of course, you see, in medicine, we practice evidence-based medicine.
Evidence-based medicine, yeah.
Yeah, so there's not much of study supporting to all these things.
Okay. Just for the benefit of our listeners again, crab rasam. Rasam is an Indian concoction that we all love to have when we finish our banana leaf spread, just to clean everything up on the leaf. And crab rasam is just a variant of that we use when we make with crab. And now Doctor has actually debunked that fallacy that, papaya leaves and crab rasam. Also, although the general consensus says that, this might be a remedy, but it's not backed medically. Yeah, Doctor?
Yep.
Okay. Doctor, thank you so much for setting aside your time today. We had a lot of insightful updates from you. You taught us about a lot of things, and I'm sure our listeners would have been enlightened with what you shared with us on dengue. Is there anything else that you wish to add on, Doctor, before we part ways with you?
Know what is dengue. The information is very easily available in your palm. All of us carry our smartphone and phone. Just Google on the update what are dengue symptoms, and if you have got those symptoms, don't hesitate to go to any medical facility. You can go to any medical department, or you can walk into any private clinic or government health facility. Get yourself checked. At least you know what you're dealing with. So from there, you'll be advised whether you can be monitored at home or you need to be admitted. If let's say if you are advised to stay at home. Stay at home, hydrate yourself, take paracetamol, as well as you have to protect yourself as well as your family members.
Hmm.
So if you need to sleep under a mosquito net, please use it. Use
Right.
repellent. And of course, that is something you do once you get dengue. But there are a lot of other things that you can prevent them. So if you need to go out during the 6 something or 7 morning or evening, that's when you see the kids go to school and come back from school.
Right.
So use the mosquito repellent. See, nowadays it's available in a patch form.
Yeah.
So put the mosquito net around your area. If you really need to go out during that time, use a protective clothing, long sleeve, long pants, as well as get yourself always updated what's going on around your neighborhood.
Okay. All right. Have a word with the neighbors, because sometimes, we don't have this habit of speaking to our neighbors to find out what's happening. And the next thing you know, when there is a case, that's when they go out and speak to people and they realize that, yeah, it's been an ongoing issue. So like you mentioned, Doctor, I like the fact that you emphasize on that, to go out and speak to your community so you know what's happening around, yeah? Hello, Doctor?
Yes,
Okay. Okay, all right. Doctor, thank you so much for setting aside your time today on Health on TRAXX. It was a very insightful conversation, and we look forward to having you again on another edition of Health on TRAXX. You have a good day, Doctor.
Thank you, Edna.
You're welcome.
Thank you.
All right, and that was Dr. Siva Perumal, a consultant emergency physician at Prince Court Medical Center today. He spoke to us about dengue cases in our country and how we can stay vigilant and protect ourselves from the spread of the virus. And, of course, also he, clarified some misconceptions that we always had. Papaya leaves and also crab rasam may just not be the cure because it's not medically backed. Time on the clock, 11:45. So, which means we've got the news coming up. But don't worry, I'll be back again just to give you some more insights here on TRAXX Momentum. Health on TRAXX concludes right now here on TRAXXfm.